I work Havering Council when a lady spoke kindly, said I could use the office for a meeting.
Oh, right, okay, so it might be a bit warm in there, though.
Yeah. She told me about the Brazilian conditions.
Oh, gosh, yeah, so do open the window and make yourself comfortable. There's drinks there if you want to help. A cold water machine just behind the door there, so that's always nice and hot.
Sorry, I'm Max.
Hello, Max, I'm Dawn. Dawn, one of the managers from Havering.
Oh, lovely to meet you.
Okay. All right, then. Good luck in there.
Hello, hi everyone. Nice to see you guys. How's everyone doing? Everyone's eating lunch. I'll leave you to eat in peace, don't worry. Hi everyone, thanks for joining. Nice to see you all as always. Just getting up my agenda. You guys are the early birds.
I haven't put my mic on because you won't want to hear me eat my cracker.
That's okay. Lee, I thought you guys had a clash today. Oh no, that was earlier, wasn't it? I think your integrated team meeting. Hopefully people will be able to come today then to this one. Hello, everyone joining. Everyone okay?
Hi, everybody. Nice to see you all.
Hello. Still wait a couple of minutes for everyone to join. Welcome everyone who's joining us. We're just giving it a couple of minutes. We'll get started in a sec. Just waiting for some other folks to join us. There might be an influx of people at 1 p.m. One more minute. I think the assistive tech guys are starting. I'm not sure if they're with us yet. I'm sure they'll be jumping on in a second. Welcome everybody joining us. Hi everyone, welcome.
Hello.
Hello, nice to see you, Debbie. You all right?
Yeah, I'm good. Thanks. How are you?
Good. You haven't been to one of these before, I don't think, have you? It's your first one.
No, I haven't.
Welcome. I'm not sure that the assistive technology guys are here, but I know Jessica, you're here, so I might promote you to the front of the queue, depending on if they arrive in time. So sometimes we move the agenda around a little bit. Is anyone from the telecare assistive tech team here yet? Just quick shout out. I don't think so. Jessica, are you okay to go first? Would that be all right? Okay. Yes,
Hello.
over to you when you're ready.
Thank you. Can you hear me okay?
Yep,
Yeah.
all good.
Fab. Yeah, so hi everybody. Yeah, thank you so much for having me. My name is Jess and I am currently the lead of a project we have in Havering called Mums Matter. So Mums Matter is a 7-week wellbeing course where we invite mums to come onto our online course and we support mums who are in the perinatal period. So this is a mum who has a baby from the age of 0 to 2. We have a 7-week course and the course is looking at ways to help our mums improve their mental well-being. The course has been created by a group of mums who they themselves were going through sort of some times of motherhood that they weren't enjoying, were quite tearful, had quite low mood, felt quite anxious. So the course each week is a different topic centered around, confidence building, negative thoughts. We look at the expectation of being a mum. Sometimes we might have thought it was going to be quite doddle, everyone's a mum, it seems these days, babies sleep fine. Then the reality is, but our babies don't want to sleep when we want them to sleep, and maybe feeding's quite hard, and there's quite a few difficulties that can arise. So we have mums in Havering who attend our online course. We currently have the course running on a Friday morning online. It's 2 hours. So mums can get referred into us. They can either self-refer, or GPs can be referred by their GPs, health visitors, the children's centre refer into us, or like I said before, self-refer. And it's a brilliant course. We've been going 3 years now in Havering. We did win Best Support Group last year as well, which was a lovely recognition for from the mums that have come through our project the last couple of years. And what we try and do as well is just support the mum. We try to encourage them to take up a wellbeing call while they're on the course. So they have the online session with us on a Friday morning, and then within the following week, if they wish to, they can have a wellbeing call from us as well. So we get to check in with the mums, see how they're doing, identify any other support that we think they need. We encourage our mums, once they've done the course, to have to come together with the mums on their course and create sort of friendships. We do coffee mornings at Mums Matter, so we invite them to come along each month for a coffee morning when they've done the course. And we have a lovely event at Christmas as well that we encourage them to come along to. So we try and keep that peer support. When they've done the course as well, we work with the mums to see what other support they need going forward. So we then signpost them to other services if needed. But it is a really great course. And if anyone would like to attend one of our sessions as a guest, or just to find out what we do at Mums Matter, then we would, we'd really be open to any of you coming along. Okay, any questions?
Amazing. Thank you so much, Jess. Does anybody have any questions? I've put the Joy link as well for our Joy users on the call. Any questions at all? I'll make sure I send out all the info as well. You must have covered everything because there's no questions.
Oh.
But
but no, it's a lovely course. I know in Havering there isn't a lot out there for perinatal period. So it's such a vulnerable time for a mum. From conception to when the baby's 2, it's a very, very vulnerable time. And I think in Havering we've only got Mums Matter, and then we've got Butterflies, which is from when the baby's 0 to 1, and Mums Matter is from when the baby's 0 to 2. So there isn't, as far as I'm aware, many services that can support mums. So yeah, if you have any mums that you think that would maybe benefit, I mean, even if you want to have my details afterwards and just give me a little email, just if you've got any questions you might think of, or just there may be someone you've got in mind that you think, actually, I just want to email Jess to find out if she is suitable, then I'm happy for you to do that.
amazing. Thanks so much. Lee, did you have a question? You're just on mute, Lee.
Just on the age of the mums, is there any caveats around how old the mums need to be, or those in the group? Are they? I'm thinking from a young mum's, very young
Yeah.
mum's point
So
perspective.
Thank you, Lee. So 18 is where so historically, and I can check it, but I believe it's 18 mums. So we don't, mums 18 and over. But I can check that and I can get back to you on that.
Yeah, because butterflies is 18 and over as well, isn't it?
Yes, I
Right,
believe
okay.
so. Yeah.
Just a little thought there. There's a little gap.
There's lots of gaps.
Yeah. Okay,
Yeah,
thank you, Jessica.
Thank you, Lee. No, thank you.
Any other questions? All good. Thank you so much, Jess. Appreciate your time on that. We'll make sure we send the info out afterwards and your details.
Lovely.
Amazing.
Thank-
Our next item should be the assistive technology and telecare folks, if you guys are with us. Are you guys with us at all? I'm not sure if they are yet. That's okay, we can revisit that one. I don't think Andrew's with us yet from Romford Skate Park. I know he said he's coming at 1:30. Natalie, is Natalie from Public Health with us around the babies, children, young people needs assessment at all?
I'm here, Sophie.
Over to you. Sorry, much earlier than originally put in the agenda. I hope that's okay.
That's all good. I'm just going to share my screen. Can you let
Of
me know
course.
when you can see the presentation? It's just a couple of slides.
Yep, all good.
All good. Okay, let's just make this a bit bigger. Okay, yeah, so I'm Natalie and I'm a public health strategist in the public health team. Thank you for having me along today. I just asked to come along because I wanted to talk to the group about the babies, children, young people emotional wellbeing needs assessment that we have just started working on. So just quickly, a bit about what a needs assessment is if you're not aware of it or you're not a part of public health and our terminology, but it's basically a systematic approach to understanding the needs of a particular population. So in this sense, it's babies, children, young people, but it's about their emotional well-being that we're focusing on. Alongside the data that we can get on them, we also consider other factors such as social, economic, cultural and behavioural factors that influence health as well. So the aim of the needs assessment is to review the well-being, the emotional well-being needs of babies, children, young people, particularly like in Havering, and this will inform our wider mental health needs assessment that has just been completed. It will give us a way of understanding what needs to be done locally, and it will provide evidence-based recommendations for local actions to help reduce inequality and improve outcomes. So basically that's about making sure that all babies, children, young people have a fair and equal chance to live a healthy life, regardless of their background, regardless of income, education or where they live. It could mean improving access to services or removing barriers that may prevent people from getting the help they need. So why are we doing this? Well, children and young people's emotional and mental well-being and mental health is a critical aspect of their overall well-being. It shapes their development, relationships and their future outcomes. In Havering, there's a growing recognition of the importance of addressing mental health challenges early to ensure that every child and young person has access to the support they need when they need it. So the areas to be covered by the needs assessment that we have started on is prevention, early intervention, management of emotional well-being, and access to services. And we are splitting the needs assessment into 3 groups. So that will be the early years groups, which are 0 to 5-year-olds, primary school group 5 to 10, and secondary school adolescents with 11 to 25. Where it says 25-year-old young people with SEND, it's not because it's only for 25-year-olds. It's that For people without SEND, it goes to 18. But if for those that have SEND, we take it to 25. So they do, they are part of every one of these groups. It's not just that group. It's just that we mention it there because they have the extended age there to 25. For each of these groups, we have subgroup meetings, and members of those groups include public health, obviously, SEND team, social care, NELFT with their 0 to 19 service reps. We've got early years and youth services involved, education teams. We've got the child and adolescent mental health services, otherwise known as CAMS. They're involved. The HES team, which is the Havering Emotional Support team, are also involved, as well as children's centre management and voluntary sector representatives. Within each of these separate areas of the needs assessment, we are going to be looking at items like national context, local services for each of these groups, what's out there already universally, what's out there for targeted groups and high risk groups, what local insight is available. So what engagement has been done with children and young people and families already, or what is planned to be done with them in the very near future, so that we can understand their experiences of different services of mental health, and understand what is missing, what's important to them. And then we also need to be looking at the accessibility and training and support for staff within those areas. And then the evidence-based approaches for delivering services or interventions that are effective. So looking at what other boroughs are doing and what's being effective, and then ultimately making recommendations and actions to make improvements and improve the health and well-being of babies, children, young people with their mental health. In terms of this group, as I said about the members of these 3 subgroups, we are actually wanting to know whether any of you would like to be involved in one of these subgroups, if they are relevant to your area of work, and you feel you should be involved in the discussions around the information that's going to go into this needs assessment, or whether you have colleagues that you would like to suggest take part. Alternatively, or additionally, we'd also like you to share any qualitative or quantitative data that you might have about your service delivery, whether it's previously collected or it's planned in the future. We'd like to see any survey results or focus group write-ups, reports, any service evaluations, just to give us a better picture of what's going on already, what's planned, and what we know from what's been happening. So yeah, if anyone has any suggestions of what to include, of any data that they can share, or whether you would actually like to be involved or nominate a colleague to be involved in these discussions going forward, then please do send me an email, and we will be in touch with some dates with you and give you some more information. And that's it really. Any questions?
Any questions for Natalie? We'll send out the details so that you can sign up for any groups that is relevant and send it to your colleagues. But yeah, any questions on that one? Lee, go for it.
Hi, Natalie.
Hi.
Hiya. I noticed on your slides you had schools or school representatives. Is that of all phases, primary and secondary?
Yes, it will
And
be. Yeah.
And does that include independent schools?
I would have thought so. We're only just starting the work of engaging, but yeah, we will need to consider those independent schools as well.
Yeah, because the independent schools are usually known as independent because parents pay. However, since the Academies Bill came in years ago, we've got lots of independent schools that are used for alternative provision, where there's a large cohort of children that would fall within your group of support. So that would be alternative providers, because they have their own network, and you'll be able to gain information from the SEND team or the inclusions team under Marcus or Trevor. And under that cohort of alternative providers, you will have independent schools and free schools.
That's great. Thank you very much, Lee. It's really
You're
helpful.
welcome. You're welcome.
Cool. Any other questions? Beautiful. Thank you for that, Natalie. I think that I'm not sure the assistive tech guys are with us. I've just sent them a little message to see if they're around, but they might need to be rescheduled. I know that Well Social haven't had capacity today, so couldn't join us. I know Romford Skate Park is coming at past. So I thought for the next 15 minutes, obviously we can do a Well Havering update. So Emily, I don't know if you want to come in about your events, and then what we'll do is we'll just go for a quick, people can just share what's going on for them. I know we've got the safeguarding team who've put some messages in the chat, quick round robin of any service updates you guys want to talk about. Emily, do you want to go first about the event on the 8th of August?
Yes. Hi, everybody. Nice to see you. I'm sure a few of you have been being spammed a bit by me this week because we are finalising our event on August 8th, which is a big Live Well Havering health and wellbeing fair. So we have lots of different stalls throughout Romford Marketplace, the church, which is on the marketplace, and also Mercury Mall. I just wanted to say, if any of you guys did express interest for a stall, but you didn't confirm that with me this week, unfortunately, we've got no more spaces for stalls. So you would have had contact with me, but just to reiterate that we've had so many people sign up and it's been really, really fantastic. So thank you all for your interest. And yeah, if you keep an eye out on our new social medias, you might have seen them. You can see there's all sorts of promotions coming out for that event. We even have like a GP there, which is unheard of. So we're very excited, and hopefully we can see lots of you there. Jan, hello.
Hi, Emily. If you got a form, which I did, and it asks who you are, do you need a table, chairs, blah, 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 does that mean we've got a stall?
Yes, I'll be in
Okay.
contact with you guys on Monday, and you guys definitely have a stall.
Thank you. From the hospice, yeah. Thank you very
Yes,
much.
yeah, absolutely.
Nice. So please expect some contact from Emily. And also we would just love to have you guys in general if you want to come to the fair. So it's 10 till 2, I believe, isn't it, Emily? Romford Market.
Yep.
We're also taking over part of the Mercury. So we had so many stalls say they wanted to get involved, which is great. So there'll be loads to see, loads of service providers to meet. There'll be, yeah, you'll be able to speak to a GP without an appointment. I think we may not have a nurse, blood pressure checks, all kinds of things going on. So don't miss out on that. We'll send you the details if you wouldn't mind promoting that as well. I think that's that on that one, isn't it?
Mm-hmm.
Okay, fabulous. Just to let you guys know quickly that our new website is launching on the 1st of September. So many of you guys have been involved in making that content. If you are a page owner, or we think that basically we've asked your opinion on any pages, you've helped to make pages, you'll be contacted in the next 2 weeks with the mock-up of your page and a request for you to sign it off, feedback, etc. So stay tuned for that. All of you, absolutely all of you, will be contacted in August with a sort of early preview of the website. Please use it as much as you can. Find the bugs, find the problems, tell us all the feedback before it goes live in September. You guys will be using it on the ground and we'll have the expertise to make it as good as it can be. So please tell us how you find it. If you think it's rubbish, tell us it's rubbish. So more info to follow on that. But hopefully it'll be like the one-stop shop of everything well-being in the borough and make your lives hopefully a lot easier as well. While we just wait for Andrew to join regarding the skate park, did anybody want to come in with any updates around their service, things you want to promote? Elizabeth, you have first dibs if you want to talk about Safeguarding Conference.
Thank you. Our free Safeguarding Conference is on the 19th of November. It's in the chat. It's at my place in Harold Hill. There's good bus routes. I know it's not so good at the moment, but we think Gallows Corner will be sorted by then. And the theme is neglect. We've got the same content morning and afternoon, so you only need to come to one session because it's repeated basically. But there are separate workshops around children and adults issues, so we do hope you will come. So please do share that with people. for any voluntary sector people, professionals, members of the community, faith groups, you name it, they're invited and very welcome. So all the information's there, and you've got the links to book that in person only, to book that then on our website. Thank you.
Fabulous. Any hands up for anything anybody else wants to share? Any key updates, things to raise awareness of, exciting things going on, things to celebrate? Anything at all? So go for it.
Sorry,
Mid
I'm going to be
mouth,
sending this out. I'm going to be sending this out. I was eating my lunch to everybody. This is a new project that we're starting. Which it's called the Armed Forces. It's the Armed Forces Community Programme. It's going to be going live very soon. I'll be sending out letters to everybody that I've ever spoken to ever. We'll be getting information about it. We're really, really excited. It's going to include like a 6-week course. We're also everyone knows Chaz. Everyone knows Chaz. Chaz is supporting us, and we've got lots of support from armed force organisations. There's going to be a 6-week course. It's going to be held at the St George's Health Hub, starting in September. But there's also lots of family things. It's about not only supporting our armed forces, sort of serving and veterans. It's also about their families and children. So we'll be having sort of fun days as well. Moving forward, we've got the funding for a year, so we're really, really excited about it. So I will be sending it out. So, you'll get an email from me possibly tomorrow. But yeah, no, really, really excited about it. So that's
amazing.
Me.
I'm really looking forward to promoting it. Once you've got the stuff, we can get it on Joy,
Thank you,
all that
Sophie.
good stuff. Nice.
Lovely. Cheers. Thank you.
Sam, did you want to come in?
Yeah, thanks, Sophie. Yeah, got camera issues, so able to put those on. So we had carried out some meaningful sort of engagement piece a few months back. And it was around, so we had actually connected with a grassroots organization from Me to You. They are a service that work with Black, African and Caribbean communities in Havering, particularly around cancer. But the objective of our workshop was to revisit sort of the long-standing barriers to healthcare challenges, and to also explore vaccine hesitancy in these communities, again, aligning them to the sort of the current policies around Core 20+5, amongst others. And the insights are being shared at the moment, widely internally, as in Havering and across Nell. But yeah, I'm just leaving it out there. If there are any teams or services I'd like to know more about this piece of work, more than happy to come and share, or even just have conversations around the work in general. That's it for me.
Amazing. And there's a really great report Sam and From Me to You have done, and we can share that as well for your interest.
Thanks, Sophie.
Asosa?
Yes, thank you, Sophie. I just thought to promote our CCAT schemes here. So the CCAT scheme is free condom distribution for young people aged 13 to 25. And we're looking to see how we can increase awareness around it and also sort of improve access as well. So we're looking for, people who work with young people who are open to being private outlets for the people that they service, for the young people that they service. And we're open to offering trainings and bringing staff onto the platform in which they can register and then support with the free condom distributions. And if you have any newsletters that go out to young people, it'd be nice to link in with you as well, so we can see how we can promote the CCAT scheme. Thank you.
That's great, Asosa. Also, I'll reach out to you separately, because I think we could do some stuff around that and encouraging some more locations to sign up. That's really cool. We'll
Exactly,
talk about that.
yes, yeah. Thank you.
Amazing. Max, over to you.
Hello, everyone. Hello. So I'm Max. I'm Community Hub Coordinator, Havering Council. I'm 4th day in the job. So that's part of the refugee and crisis response team. So I'm supporting different hubs that are in existence, such as the Harold Hill hub and Rainham hub, and looking to set up new hubs in the borough. So I wanted to, oh, thank you, Emily. Yeah, so I'm really kind of learning about all the kind of brilliant work that you guys do in the borough, and looking to kind of connect with different service providers to you know, expand what we have happening in these hubs. So I'll pop my email in the chat if anyone wants to say hello. And yeah, really excited to be in this role, and to kind of really learning about how all the different organisations interlink. So
Yeah.
thank you.
No, thanks for jumping straight into all the network. That's amazing. Emily and I have got on our list this week to reach out to you, actually. Lee's asked us to reach out to you, so we'll be getting in a call with you soon. You've got all these lovely people here to reach out to you. I know Zoe's probably wanting to talk to you about the tapestry hubs. Is it, Zoe, that might be what you're trying to talk about?
I would just hopefully at the end, we're looking at doing a project over the 6 weeks term with the kiddies on holiday, and I just wondered if I could quickly say something about that, if that's okay. Sorry, is that okay? But obviously, yes, I can put my email in the link and then meet up with Max, if that's okay.
That's all good. But yeah, Max, no, I will reach out to you about ways of working together for sure.
Yeah.
Brilliant.
Darren, was your question relating to Max's thing?
No.
Okay. Do you want to go next, and then we'll bring Zoe in?
Oh, okay. Yeah.
Go for it.
So my name's Darren Alexander. I work as the Assistant Director for Housing Demand at Havering. So all things homelessness and temporary accommodation is my area. We are currently writing our new homelessness strategy, moving on from the 2020 to 2025. This one will be 2026 to 2029. Or no, actually, we can continue from 25 to 28 because we're halfway through this year as well, actually. So we are asking for professionals to join us in the strategy design. I believe we've got a meet next week. It's called the Homeless Forum with Alfredo Boateng. So I will get a circulation through Sophie. So if you can join us to talk all things homelessness strategy, then please come and attend there. We will send a circular out as part of our consultation, probably around the late or early autumn period anyway. So if you can't make that, you always have an opportunity to speak through the consultation for 12 weeks anyway. Thank you.
Nice. Fab. And please do include Emily and I, and one of us will be at each of your meetings as well. Sounds great. Zoe, did you want to share about your work over the summer?
Thanks, Sophie. So it's just really to ask everybody. We're working with Havering Food Alliance, and part of the project is to support children over the 6 weeks holiday. And that is for us to deliver and pack together boxes of food that will support children and families over the 6 weeks half term. This is part of a project with Havering Food Alliance, and we're really desperately looking for volunteers and any donations of food that we can put in the boxes for families. So I can put details down, and hopefully people can get in contact with me to arrange that.
Fab. We'll send that out afterwards as well, and any way we can support, let us know. And I know that Neil has joined us around talking about some telecare assistive tech. Neil, over to you if you're ready.
Yeah, sorry, Sophie. Darren's got his hand up as well, and I was just going to ask a question for Zoe as well.
I think it might be.
Was it?
It definitely is a legacy. I don't know how to bring it down. So, oh, there it is. Finally worked.
Cool.
Sorry, just before I go into me, if I can just quickly ask Zoe. Zoe, is there an age limit for your volunteers, as in too young?
No, not that I've been told through my CEO, no. Anybody that can help Monday to Saturday from 10 to 4 o'clock, anytime, whether it's an hour, 30 minutes, anything would be fantastic.
Okay, lovely, thank you. Right, going back to my service, thank you, Sophie, for inviting. My name's Neil Bartle. I directly manage the telecare service and that includes emergency responses 24/7 around the borough, as well as installing equipment. I also contract manage the building alarms for the borough, so we've got around about 150 building alarms for the borough, and that could be intruder and fire alarms, and also the out of hours, which many of your services might be involved in. So that we cover 28 services out of hours. So when people turn their phones off at 5 o'clock, we then take over of what their requirements are. For the telecare, most people know telecare as the emergency button what old people wear around their necks, or the pull cords what you have in schemes, which is correct. But we're not limited to age or ability. Anyone can have our service as long as someone's willing to pay for it. And that may well be, we have people that for their own independent living, they might still want to go out and feed the birds out in the garden, and they're worried about going out in the garden and falling and being out there all day and things like that. So with our equipment, they can go out in the garden, they can press their button if they was to fall, and then we can act upon that activation. So it gives people a lot of independence. It gives them peace of mind. It gives family peace of mind, because that family member might be at work during the day and not allowed to have their phone on, if they're a teacher, etc. Or they could be on holiday, or sometimes people don't have family or don't live local. So we respond. We take that responsibility. We respond and check on that person to make sure they're okay. And then we'll also notify the family if the individual gives approval for the next of kin to be contacted. We always say, do you want your family contacted? And sometimes they say no, because they would tell me off. So again, we'll override that if we feel it's really necessary. So if we feel that person needs an ambulance and they're refusing, and then we will contact the family for them to override us, and call an ambulance directly, etc. We do have lifting equipment, and they're called razors. So basically, it's minimal movement for the individual. So once we've done our checks, I should say we're all first aid trained, we're all very experienced. So as long as the individual is happy that they've got no injuries, we're happy they've got no injuries following all the checks we've done, we'll assist that person up, and we'll use dedicated lifting equipment. And as I said, they're called razors, and we've also got equipment called mangarelks. They slightly work different ways. So it's and again, once they're up, we'll then make sure they're comfy back in bed or back to their chairs, etc. We do, going back to the equipment wise, as I said, many people know it as just the pendant, but we do other equipment. We do work for the sensory team as well. So that might be, you might have like parents with hearing impairments, and then and they've got a newborn baby, so they don't hear the baby crying. So we can put in devices that when that baby cries, it then either vibrates a pager what the parent is wearing, or if they're asleep, it'll vibrate their pillow. So again, it gives them more independence. They're not relying on other people to go about their everyday living. It could be doorbells. Again, it activates the same systems. We can do bogus caller doorbells. So if someone's concerned about their parents, or it might be social workers are concerned about someone that's had bogus callers or likely to let a bogus caller in, we can fit doorbells so it still rings like it still chimes like a normal doorbell would, but in the background our equipment's activating silently, so the caller is unaware that someone's listening into the conversation. And then we can then call the police and say that we've got a potential bogus caller at vulnerable persons. And the police are very good at acting on their blue lights to get there as quick as possible. Domestic abuse. So again, the same kind of system, but the individual can wear a pendant around their wrist, around their neck, in their pockets. So if they are suffering from that abuse from their partner or next door neighbour, whoever it may be, they can activate that equipment. Again, it activates silently, and we can call the police to attend. So it's a wide range of equipment, depends on the individual needs. We try and set it up but bespoke for what that individual needs, rather than just this sensor does this job and that's it. We'll adapt that sensor to how we need it to work for that individual. So that's basically an overview of my service.
Fab. And Neil, did you cover at all, sorry if I missed it, just about who's eligible to get it free versus who pays for it, that sort of stuff?
So we've got at the moment, there's two routes of funding. You've kind of self-fund it themselves. So they pay us directly for the service, depending on what it is they require. And you've also got it done through adult social care. Now, with adult social care, they have got a strict criteria of that you have to meet their needs, the adult social care's criteria. So a simple way to put it is if adult social care supply a care package, then they will also fund the telecare a majority of the time. We do also do it that if adult social care are pay for like a basic package because they're saying that's all you need, but the individual wants all the extra stuff that we do, then it can be a combination. So adult social care will pay part funding and the individual can also be funding for their additional equipment. So as I said, as a general rule, it's under, I think it's £20,000 worth of savings and also if they have a care package provided.
Fab. Thank you so much for that. Does anybody have any questions for Neil, all things assistive tech, telecare? I'm sorry if I pronounce your name wrong. Is it Pakavi?
Yes. Thank you. Yeah, that's correct, Sophie. Yeah. Sorry, my name is Parkavi, and I am a first contact OT in Havering Crest PCN. I just wanted to know that, in my years of experience, I've heard that, some of the benefits, if some patients receive certain benefits, then it is free of cost for them. So I wonder whether if it still applies in, that criteria for yourself.
To be honest with you, it's the housing's department that does all the financials in the backgrounds. We send them the information of the person, like their bank account details, for example, and what the costs are. I don't know what the workings are in the background for entitlement to, if they're on universal credit, whether they get a discount, et cetera, et cetera. To be honest with you, I don't know. That's all the workings out in the background. For general, for adult social care and stuff like that, and I don't think any of that's taken into consideration.
All right, no worries, that's fine. Sorry, what's your so you're based in the council, the Havering Council?
Yep.
Telecare, is that right?
Yes. Yeah. And if you ever want to look for any information, that could be for your own, personal benefit, it could be for work-wise. If you just type in Havering and Telecare on your internet, that'll bring it up. Where if you're part of Havering Council, then we're on the intranet as well. But with our web page, I've done that you can do it by medical need as well. So if you've got a family member or someone you're dealing with, and they might have dementia, for example, or hearing impairment, you can click on that need and it'll bring up the equipment to what is suitable for that individual need as well.
Yeah, fabulous. No, thank you. Yeah, I do that usually. Yeah, I do Google it and then go on to give information, contact details to patients as well. Yeah, no, that's great. Fantastic. Do you do raises as well? Do you provide raises to the, vulnerable?
No, so we don't actually provide them. It's just that we use them. And that's razors in lifting equipment, not razors in having a shave. But that's a razor as in lifting equipment.
Yes, the manga or the yellow.
Yes, yeah. So we don't provide them, but my staff use them. I should just make everyone aware as well, just in case you're not aware. You might have seen adverts on telly about the digital switchover, where you've got the little old lady concerned about her digital switchover, and some people are not even aware that their telephone lines are being switched over. But basically, every single analog phone line, so old copper phone lines, anything what uses that through the whole country is being changed over to digital. And this might be why yourselves or your family have received letters or phone calls from phone providers saying we're changing your line over. Now, with our equipment, our old equipment, it wasn't compatible. So if someone switched over to a true digital line, then our equipment won't work. And unfortunately, what would happen is the engineers would just leave our equipment unplugged, sitting on the side, and just say, you need to contact your provider and they'll give you new equipment. So what we've done, we've purchased all new equipment. We're currently rolling that out. So it's going to take probably about 18 months to cover everyone. And that uses 2 SIM cards, so it doesn't actually use the phone line. So it removes all that risk from phone lines. Because unfortunately, the way it's going to be, and it's the same for everyone in this meeting, if you have a power cut, your broadband will be cut off, your router will be cut off, which means everything connected to that will be cut off. So you'd have no telephones, no TVs or anything, because it's all running through that broadband and that telephone line. So that includes equipment like ours or anything else what attaches, any kind of heart monitors or anything what runs through a phone line, they will not work. With the systems that we're putting in, they will work because they don't use a telephone line. So even if there's a power cut, it's got a built-in battery, it's got 2 SIM cards and they're both roaming SIM cards. So if a network goes down or a mast goes down, or like Hornchurch where they removed one of the masts there, our systems will pick up the strongest signals. So it's just to make everyone aware that we are in Havering replacing all that equipment as well.
Cool. Any final questions for Neil at all? His details will go out afterwards as well, obviously. Fab, thank you so much for jumping on to do that, Neil. Appreciate it. Fab. On to our final agenda item, and I think Andrew's with us to talk about Romford Skate Park.
Oh, okay. Right. I'm Andrew Borden. I haven't put my second name on there. Apologies. I'm a volunteer at ROM, and some of you may have heard of ROM Skate Park. Some of you might have even BMXed or skated there, but generally speaking, it's lost, it's been forgotten, and it's a great facility. And as a volunteer, we're trying to get it to work again. We have the blessing of the landlord to run it. He runs the cardrome, or at least his family run the cardrome. So that will probably answer my next question, or my next point. ROM Skate Park is located in the cardrome area, so it's on the borders of Hornchurch and Barking and Dagenham, and we're opening during the summer holidays. Basically, the Rowley family want the park to continue. They want to sell the cardrome at some stage, and there's a chance that we may be able to get some SIL funding to get to launch the skate park further. But in the meantime, the volunteers are keeping it open during the summer holidays and at weekends. We've got free equipment for the first session. We've got free skateballs for the first session, and we've got accredited coaches on one as well. So we're quite keen for youth groups, clubs, schools to use the skate park because it will keep it alive until we get to a point where we can improve on the funding. We're doing okay. We've been open for just over a year. We're just putting a ramp in place today. We're hoping to get some, probably even toddlers, mums and toddlers coming to the skate park. So what we want to do is raise an awareness. And I noticed, I think there's, living well as far as Havering is concerned, it just seems to make sense that a grade 2 skate park, the only one in the country, well, actually, in fairness, there's one in Scotland now, but it's such a unique feature. It's a fantastic concrete playground that we've now made safe. It's enclosed, and we want to use it more. So it's open at weekends 10 till 6. We charge £3 for under 12s. Generally, it's £3 an hour for anyone. And like I say, there's free equipment that we use to start with. We do expect people to either buy their own equipment or hire our equipment after the first session, but they can make up their mind whether they like skating, BMXing or scooting. We're extending that to roller skating. We've got a roller disco coming up on Friday week. We've also got a community group of surf skaters, which I've come across before. They're hiring it on Saturday night. So that's an open session as well. So we're trying to get more things going on at the park. So you're all very welcome to come. And I'd love to talk to some of you because you're all connected to various parts of Havering and youth groups and community groups that could actually benefit from it.
Amazing. Thank you so much. And I know I'm going to send out some connections for you shortly to other youth groups.
Thank you.
Does anybody have any questions for Andrew? And I also, when I spoke to Andrew, he said, you said that everyone's DBS checked. You've got the GB skating and sort of Yep. So it's all sort of all the risk assessments and everything is all done as well. There's some people that want to chat with you in the chat. Does anybody have any questions at all for Andrew?
Just quickly, if that's okay. Sorry, Sophie. Sorry, I'm just really nosy, intrigued, and I'm actually roller skating myself. Can I Is there a park for anyone? Because I've never actually heard of this particular park, so I'm just wondering.
This is the sad thing about Rom. It's been there since 1978, and because it fell into disrepair a few years ago, it's dropped off Havering's radar.
So where is it?
It's on the Upper Rainham Road, where the Hornchurch Cardrome is.
Upper Rainham Road.
Yeah. Sophie, can I give you a website details or contact
Yeah.
details that you can ping on later? That way you can contact me if I can get Sophie to give you the details. And I can let you know more. We're keen to get families down because it's been completely lost. Like I say, it used to be used a lot. It was a squat for 4 years, and we've took it over last year. It'd be lovely to have more roller skaters. We don't see so many of those at the moment.
No, I don't see many people doing so in the park, but I'm really needing in some kind of. I just need some kind of a bigger space. And
Great.
also,
Well,
are you
this is
promoting
it.
it at schools or not yet?
Yeah, I'm going to assemblies, but it's such hard work to go to an assembly. Sorry, that's the easy part, talking to the kids. But to get the schools to come and have lessons, you know, they're limited with funds. They're on a path as far as various activities are concerned for this summer. So we are trying to get to schools, and we've had a few school lessons on site, which has been really good. So, you know, Harrow Lodge being one of them, but which is one of the nearest schools. So there's loads of opportunity with youth groups. We could possibly even get funding if we can team up with a youth group. We can then apply for funding, for example. So we're sort of in at the moment. We're a bit odd. We're in a bit of a vacuum. We've got a great park, but we haven't got great contacts, and that's why I'm here.
Brilliant. That sounds really, really, really good. Excited for you. Thank you.
Thank you. If we can talk later, and anyone else is invited to just sound us out. We're doing kids' birthday parties as well at the moment as well, and that's going pretty well too. So there's lots of opportunities. The only negative with the skate park is it's open air. So if it rains, which it's about to do in the next 5 days, we can't open up. But we've got the summer coming. We're open on Mondays and Friday afternoons for the kids' holidays. So it'd be great to get more people in.
Are you open this summer?
Yeah, we're open. This is our first summer actually because we're volunteers.
Monday, Friday, afternoons only. Is it 12 onwards?
12 till 4 we're doing, yeah.
And is it any age group?
Any age group, but the under 12s come in for £3 for an hour, just so that they can work out whether they like it or not.
And do we have to book in advance?
No, just turn up. It's an acre of sculpted concrete. There's plenty of room to rattle around in there.
So I can use my roller skates and my kids can use the normal skates, like skateboard.
Yeah, and scooters and BMX. We're keen to get everyone down.
But I'm gonna try it myself, and then if I like it, I'm gonna recommend it to the schools.
Brilliant. That's what we want to hear. Like I say, we've got equipment as well. So for the first time, we've got helmets for people all sizes. But after that, we charge £3 to hire out the kit.
Sorry, so the helmets, is it available on site?
Yeah, we've got all the kit on site.
Brilliant, even better. That's great. Sorry, I don't want to take too much time. I'm really excited.
No, that's fine.
Thank you very much.
We can go offline, and you contact me anytime. It'd be good to talk to, and that applies to anyone if you want to sound us out for activities.
And Andrew, sorry, what's your surname again? How do you spell it?
Borden, B-A-W. Sorry, I should have put it on. B-A-W-D-E-N. Andrew Borden.
But all the information will go out. We'll send it out to you guys. But
okay.
Thank you.
Thanks, Sophie. Thank you.
Thank you.
Neil, what's your question?
Yeah, it wasn't a question really. Well, it was kind of a question as well, but I'm showing my age now. But yeah, I used to skate there over 40 years ago. So shows as you said, when it was first opened kind of thing. And it used to be absolutely packed over there with people. Now, I noticed the other day, because one of the biggest issues there was trying to find somewhere to park. But I did notice the other day, it looks like behind the back there's parking. I see cars trying it. So can you park there now?
There's lots of free parking. The landlord cleared out a lot of the space, so we have got room for 40 plus cars, and it's free parking for people, so it's no problem at all.
And you follow? I assume you follow that around from going to the right of the petrol garage and just follow that road right the way round to the back.
This is the oddity. It doesn't front Upper Rainham Road, or at least access. You can't. You have to go across a petrol forecourt, turn left, and go into the double gates.
Yeah.
So it's exactly that. So it's a 1978. It's stuck in the 1970s, unfortunately, when people didn't really have cars, or many people.
Yeah, exactly. Lovely, thank you.
So hopefully see you. There's no excuse just because you stopped 35 years ago.
No chance now. No, my daughter volunteers up at the Beavers as well, the Scout group up at Hornchurch. So we'll put that forward to them because they're usually trying to do something for the kids there as well.
Brilliant. Yeah, we've had first and second Hornchurch. I don't think there's a third Hornchurch. So, but we're looking for other Upminsters and various various scout groups. So it's very exciting. We're very pleased to see new people.
Excellent. Good luck.
Thank you.
Nice. Lee?
You're on mute, Lee.
You're just on mute.
Right, sorry about that. My mouse was playing silly ones with me. Hi, Andrew. From a school's perspective, I wonder how sort of what the take up has been from schools and how they work around like the health and safety implications, because that might be, it may be, may not be, but it may be a slight barrier to them taking it up. And I think if with your promotions and stuff, if you've got all that in place and you can mention that and mention the parking, then you may have an opportunity to maybe invite, you know, some of the teachers down for like an open afternoon or something.
Okay, that's a good idea. Thanks.
But it's just food for thought, because when children go out from school or schools recommend something, a lot of the time it's about that concern around injury. And I would imagine, not that there's a lot of injuries, but it looks like there could be.
No, it's absolutely right. Hurtling around a skate park with huge bowls, what could possibly go wrong? So no, I'll approach the schools on that basis. Thank you very much.
Yeah, you're welcome. You're welcome.
Fab. We'll send all that information round, but let's try and pack out the skate park at the summer. Let's send all the families there.
Thank you.
Yeah.
I'm sure they would be open to hosting some team meetings there as well if you guys want a nice little away day option.
Oh, can you imagine it?
Yeah, it could be fun, guys.
Yeah.
It's so good to see you all. Thank you so much for coming. There's some comments in the chat. We'll send some bits out afterwards. Please do forward people. I know people are really busy at the moment. I think there's less attendance at this at the moment over the summer. But please do forward on to people you think would find it helpful. The more the merrier. It's open to everybody. If you want to present, let us know. We're taking a little break over the summer. We're not here in August. So have a lovely summer, and we'll see you back on the second week of September. And it will start monthly again from then. Agenda to go out shortly. But so lovely to see you all. Have a good summer.
See you later, Sophie. Thank you.
Thank you.
Bye.
Bye.
Sophie.
Bye. Bye. Bye.